parts of this law. Washington Congresswoman Kathy McMorris Rodgers is vice chair of the House Republican Conference. She's actually the highest-ranking Republican woman in Congress, and she joins me now. Good morning, Congresswoman.
Good morning.
All right, I want to ask about this repeal effort. Since there isn't going to be an alternative of what gets put into place, isn't this nothing more than a symbolic vote to set up the fall campaign?
This is a vote about policy. House Republicans believe that Obamacare is bad policy, that it is actually going to threaten the high quality of care that we've enjoyed in America, the medical innovation that has taken place in this country. It imposes huge taxes on the country, and Americans actually oppose this bill more today than ever. And the Supreme Court, a week ago Thursday, ruled, yes, that the law is constitutional and that the mandate is a tax, but that does not mean that this is good policy, and we're going to take the vote today to repeal this bill, get it off the books, and start over on health care reform. On
public opinion, it's actually pretty split now. It actually has shifted a little bit. I mean, I know that maybe that doesn't fit in with some of the talking points on this. It was a little more unpopular for a while. Seems to be a little less so. But there also seems to be a message the public is sending, which is, you know, don't necessarily throw this entire law out. There's clear majority in this latest poll that doesn't want the entire law thrown out. How do you respond to that?
Well, the people, the more that they get to see what's in this bill, the more concerns that they have. And health care decisions and these health care belongs in the hands of individuals and patients and their doctors. And even yesterday there was a report by the Doctor-Patient Medical Association that showed that 83% of doctors in this country have considered quitting because of Obamacare. Even right now, in Eastern Washington, try to find a doctor who will take a new Medicare patient. It is difficult. We're seeing the negative impact of Obamacare on health care, on access, and on quality of care. And as more people are seeing the impacts, the more they're concerned. It's estimated, CBO estimates 20 million Americans will lose their health insurance, employer-provided health insurance. Premiums are increasing, $2,100 on average this year, premium increase for American families. People are quite concerned about this law, and they'd like to see it.
Well, I understand there's always fear.
Healthcare reform.
Right. There's always fear of change. People want reform, and then they're nervous when the reform gets put in. So what's the alternative here? I mean, you talk about these different issues. You know, how are you going to bring down, for instance, the cost of insurance if you don't make sure everybody who affords health insurance gets it?
Well, yes, it is a priority to make sure that there's more access to affordable health insurance. America needs health care reform. Obamacare is the wrong prescription, the wrong health care reform, and we need to get it off the books and press the restart button. And then we need to look at those policies that will ensure that there's access for every American to affordable health insurance, health care in this country. And that can be done by creating more options, more choices within the marketplace, expanding health savings accounts, allowing individuals to go beyond the state boundaries, allowing people to pool to purchase health care, health insurance. Those are the ways that we create competition in the marketplace, more choices for the consumer, and bring back the decision-making to the individual and families rather than this big government, massive, big government intrusion into our health care in this country.
Let me ask you a quick question about taxes. I assume you are not in favor of sort of decoupling, of passing the extension on the middle-class tax cuts now and essentially punting the debate about what to do on the tax cuts over the $250,000. Any reason why to punt that? Is if the bill comes up, why not just say, okay, we do all agree on, everybody seems to agree, nobody wants anybody's taxes to go up on the first $250,000. Let's pass that now. What's wrong with that?
Well, it wasn't that long ago that President Obama said that this would be the worst time to raise taxes on anyone in America.
No, but that's not what the issue is on the table. It's about, do you have any issue with just extending it for the first $250 and punting the debate until after the election on the rest of it?
Well, this would be the worst time to raise taxes on anyone in this country. We just got the jobs report on Friday. Our economy continues to struggle. And when you look at raising taxes right now, on top of the taxes and the more costs that are going to be imposed on the American people because of Obamacare, this is less net income for American families. And what we want right now is American families to be able to keep more of their dollars and to be able to make their health care decisions. And this would be the wrong time to be raising taxes on anyone.
So you don't want to, what you're saying is, but you're not answering the question. You don't want to decouple. You don't believe the tax cuts should be voted on separately.
Well, I believe that this would be, what you're saying in that question is that you're proposing that we would be raising we would allow taxes to go up on January 1st for a large portion of the country and for many small businesses that are the ones where job creation takes place. 70–80% of the job creation in America takes place with small businesses.
So you believe what you're saying is there is not enough support if you decoupled it, that there's not enough support to have separate votes on the middle-class tax cuts and tax cuts for the wealthier Americans. There's not enough support to separate those votes? That seems to be what you're saying as well.
Well, when you in that question, you're suggesting that the vote would then be to allow taxes to go up, to raise taxes on our small business owners. A large portion of those that President Obama has said he would not extend the current tax rates would be for our small business owners that pay taxes through the individual tax rates rather than the corporate tax rates. And even President Obama said this would be the worst time to be raising taxes on anyone.
Well, that statistic, Tax Policy Center says only 3% of small businesses would fall under this. Would fall under this. You dispute those numbers?
I do dispute those numbers. When you look at the number of small businesses that pay taxes as individuals rather than corporations, it's a much larger number than what the president is proposing.
All right. Kathy McMorris Rodgers, I will have to leave it there. Republican from Washington State, thanks for coming on this morning.
Thank you.
All right.